Good for the morning throughout a good people and people where you tune in come the radio SIBC for this morning. This one welcome you as well to the 1st of December 2025. You me inside December 9 and today me follow Ministry of Health. Very happy to us for come again this for the morning for giving a big awareness you me again today marks the World AIDS Day 2025. Yeah, and with the theme overcoming disruption, transforming the AIDS response. So him not theme this year. But me take him on some for key people where come to talk this morning. Me just like him you time you inside the transport blow you or wherever you are listening now, tune on your radio. Yeah, listen lot of information where you need for survey about him health status blow you me, especially with regards to AIDS or HIV inside the country blow you me. But me got him speakers blow you me this morning and me like for welcome Mota will sit down here. But before me start, me just like for offer him opening prayer blow me for this program for this morning. Close him eyes blow you or you just listen come lo when you stop. Heavenly Father, we thank you for this wonderful morning. Thank you for the breath of life where you're giving me fala mole this morning. Without you, me fala by no save casting this fala day. But we thank you for bringing me fala through the year. Go casting this fala 1st of December again when me fala come for informing public blom fala continuously. Lo watna me fala save dream together for help them health blom me fala one or each one inside lo country blom fala. Lord, me pray for this program where blom fala continuating today and onwards, Lord, that you continue for binding me for people where inside the country and people where me follow wakala health for come up strong and work together for apum health blow me follow country. Lord, we offer this program into your hands in Jesus' name. Amen. Thank you. By me, without wasting much of our time, we'll go straight to the first speaker for this morning. Me like for welcome him now, the WHO representative, Dr. Howard Sobel, for him come and give him remarks and bam story come about him global point of view blaham about him HIV/AIDS globe. Thank you, Dr. Sobel.
Good morning, listeners. In 2001 to 2003, I worked in the HIV department in Geneva, our headquarters of World Health Organization. Before I go into my speech, I just want to say, back then we were talking about 3 by 5, putting 3 million people on HIV drugs by 2005. That was the battle cry. We have long since surpassed that. It is an amazing accomplishment what we have been able to do for HIV, and by we I mean everyone. It's as my mentor said in Geneva, if we failed to accomplish this, the world failed. Well, we accomplished this, so the world succeeded. Just want to start with that. But the progress has been uneven. It has been, we've seen declines in deaths, we've seen more people on HIV drugs, but we've got a long way to go. And it doesn't help that funding has been drastically cut to these programs in many of the funding agencies that have supported this. In 2024, an estimated 40.8 million people were living with HIV, 65% of whom were in the African region. That's 2/3 approximately. That means 1/3 is outside. We have seen the problems in the Pacific. We have seen HIV resurge. Approximately 630 people died from HIV in 2024, and 1.3 million new cases occurred. And 4 million people are living with advanced HIV. WHO, the Global Fund, and UNAIDS all have strategies to meet the Sustainable Development Goals target of 3.3 of ending HIV epidemic by 2030. By 2025, 95% of all people with HIV should have a diagnosis, 95% of whom should be on life-saving therapy, and 95% of those should have suppressed HIV. Unfortunately, in 2024, the reality falls short of that. 87% knew their status. 77% were receiving antiretroviral therapy, and 73% had suppressed viral loads. Unfortunately, beyond that, 120,000 children acquired HIV in 2024. Most people from key populations were not being reached with basic HIV prevention services. Prevention services that did not exist for people from key populations have relied heavily on external assistance, but a great deal of this was halted early in 2025, this year. Following the collapse of donor funding, the option of increasing domestic HIV funding is not immediately or equally available in all countries. Combinations of debt, distress, and slow economic growth leave many countries, notably in sub-Saharan Africa, but throughout the world, with limited fiscal space to increase their domestic funding for HIV. It is important that donors support their efforts to progressively expand domestic HIV financing by continuing to show the solidarity that is needed to avert a return to early 2000s when AIDS was the deadliest. So, the global theme this year is overcoming disruption, transforming AIDS response, calling for sustained political leadership, international cooperation, and human rights-centered approaches to end HIV by 2030. After decades of progress, the HIV response stands at a crossroads. Life-saving services are being disrupted, and many communities face heightened risks and vulnerabilities. Yet amid these challenges, hope endures in the determination, resilience, and innovation of communities who strive to end HIV. So several strategies are needed to prioritize and integrate the HIV. So the HIV response is shifting, offering a vital opportunity to reset by simplifying and prioritizing access to HIV prevention, testing, and treatment. And here I pause a moment to say that the treatment regimens are so much simpler than they were back in 2001 to 2003. We have a fixed dose combination, one pill that people can take when they used to have to time it 6 pills a day, and they could eat certain things and not eat other things. It is so much simpler today. So we have the tools to contain this epidemic. Strengthening management of drug resistance and advanced HIV disease, and integrating these services within the primary healthcare approach. Second is to address inequity, human rights, and protect key populations. Ending AIDS means addressing the inequities that drive the epidemic. Children and adolescent girls and young women face heightened vulnerabilities, particularly across the African region. And key populations, including men who have sex with men, trans and gender diverse people, and people who use drugs, sex workers, and people in prisons in all regions face increased HIV risk. Protecting rights and ensuring access to services for everyone is essential to stopping new infections and addressing health equity. And finally, scale innovation. The fight against HIV has never been so easy, yet resilience and innovation continue to define the response. As global funding falters, advances like long-acting lenacapavir, I'm going to have my expert here say it correctly when he's on for the Talkback show, a 6-monthly injection to prevent HIV, remind us that progress continues. With commitment and creativity, we can ensure that life-saving, long-acting antivirals are for prevention and treatment reach those most in need. We need to empower our communities. Communities are the driving force of the HIV response. People living with HIV and those most affected, including key populations, bring insight, courage, and innovation needed to overcome these challenges. When these communities join forces with health workers, policymakers, and partners, new pathways to success emerge, built on trust, equity, and shared purpose. I'm going to go off script a moment and say that we have been too complacent. WHO in Solomon Islands is the first to admit this. We've dropped the ball. We have not paid attention to this. Now we have a problem. We've seen what's happened in our neighboring countries with drug abuse, injection drug abuse, and HIV is now resurging in the Pacific. We've seen that we have cases in Solomon Islands. WHO is committed to support the Ministry of Health so that we can have renewed strength in numbers where we can stop this from getting out of hand. We have included this in the annual operational plan of the Ministry of Health, and we are committed to do everything we can to support the ministry and the country to contain this epidemic. With that, I thank you.
Thank you very much. That one, Nahemi World Health Organization representative, Los Solomon Islands, Dr. Howard Sobel. Now, when we give him this mic, go more for the next speaker, and he's the Human Development Counselor, DFAT representative, where I'm standing up with him today as well. Thank you, Dr. Tristan Armstrong.
Hello, good fellow morning, you fellow everyone, and good fellow World AIDS Day today, number 1 December. So me like for just say happy World AIDS Day or good World AIDS Day, lo everyone everywhere, lo this fellow beautiful country wherever you stop this time. Me like for acknowledge him or the guests or the colleagues and the friends blow here, and me like for tell him thank you too much for this fellow big opportunity for joining you fella this fellow World AIDS Day 2025. Today, you may come together for thinking, for making awareness more, and for strong commitment for stopping HIV. Me happy too much for representing Aussie High Commission, Lord this fellow important day, and me like for sharing how Australia, me sharing a little bit how now Australia providing some fellow support for Lord Solomon Island and for everywhere Lord Pacific side Lord fight against HIV. World AIDS Day has been marked this fella 1st December for calls up 40 years no more. Start lo 1988, the community come together for showing solidarity, lo fight against HIV and AIDS, for supporting the people where live with them HIV, and for remember where die finish from AIDS related sicky. Lo 2025, World AIDS Day, hemi bara important to masiat, yeah. Including here Lo Pacific, especially Lo Pacific lo this fella time, hemi important time, yeah. You must look savvy lo this fella siki. Lo Fiji, 1,600 new fella cases for HIV, hem been recorded lo last 12 months. And PNG, hemi osem declaring one fella HIV emergency lo this fella time. Solomon Islands too, yeah. You me looking quick time increase lo the cases of HIV, especially the young people. Hem big fella worry, yeah. HIV and the nara fella siki, or some tuberculosis, hemi push on big fella pressure lo health system lo you me lo here. Hem put on pressure lo society too and lo economy. So you me must act quick time. Siki hem no sabi looking border. Taiwan outbreak happened lo one fella country, lo Pacific, or another country too, sabi kasim danger. Solomon Islands, hem no different. Time for act hemi now. Lo 25 November, Foreign Minister blo Australia, Honourable Penny Wong, hem announcing one fella new initiative. Hem call him Australia's Support for Pacific HIV Action, or ASFA. Underneath ASFA, Australia by investing calls up 48 million. Actually, $48 million Australian, lo 6 fala year for helping okata Pacific country, for stronging okata national programs for HIV, TB, and okata narasiki. Big fella focus by go lo Fiji for stopping big fella outbreak lo there. Because one time happened lo Fiji, hemi affecting everyone lo Pacific, yeah. Fiji hemos hem hub lo Pacific. What na hem meaning for solo? Through this fala Pacific HIV initiative where me fala announcing finish, Australia by co-invest longo Solomon Islands HIV response with them technical expertise, with them other trainings for health workers, community outreach, and expanding testing and treatment for everyone where okata need him. Building lo existing support here. This fala new initiative hem build lo big long-term commitment blo Australia for supporting health system blo country, blo this fala country. And for other places too, yeah. So lo Fiji, me fala this time, me fala give him 3.9 million AUD for HIV outbreak response lo May this fala year. Lo PNG, me fala funding blow me fala him triple go lo calls up 10 million AUD lo this fala time for other activities where try to stop him HIV. Globally, me fala give him 266 million AUD lo global fund for fight AIDS, tuberculosis and malaria. So me Australia hem no big country too much, hem middle-sized country, but support blo me fala lo regional and global initiatives hem big, and generosity blo me fala side lo health hem very significant, because me fala care lo neighborhood and lo place where lo region blo me fala. Lo Solomon Islands, Australia hem supporting provincial health grants hem now 75 million SPD lo this fala time go kas him 2028. The Ministry of Health and Medical Services National HIV Program funding, me fala funding 1.27 million lo this fala year. Side lo HIV and TB technical assistance package, me fala give him come 1 million AUD and more. Me provide him technical assistance and service delivery through IPPF, SIPA, UNFPA, and the Doherty Institute and ASHM, two organizations for Australia. Hemina big support for supporting friends for me, minister and senior officials and everyone who work inside the health system. Australia too have worked with the Ministry of Health for look more chance for give him immediate assistance. Maybe calls up 1 million SBD quick time. So, ogata friend, HIV hemi not just one fella health issue, yeah? Hemi one development challenge. Hemi affecting family, or the families, or the communities, or the economy. You must look savvy, this fella siki. Hemi danger lo everyone. Hemi not just lo small groups far away. Hem casting community below you and you must look savvy lo hem. So lo this fella a World AIDS Day, and go ahead. Australia by stand with him Solomon Island, yeah. And Pacific region for strong imogata national HIV responses below everyone lo here, especially lo Solomon. Together, me fella say a quick time and strong more. Too much for stop him HIV and for supporting ogata people what to live with him HIV. Lo this fellow World AIDS Day, make him commitment come action. Time hemi now. Thank you, Thomas.
Thank you very much. That one him represent him DFAT and him now Human Development Counselor, Dr. Tristan Armstrong. Thank you very much for that wonderful information where public you heard come him pidgin. He's Australian, but him bar was speaking pidgin very well. Him no excuse for you say you don't understand him English now. This time by me give him for the keynote address, by me give him Minister of Health. Him sit down with him here, very busy person, but we're very privileged that him come today for give him a speech where I'm talk savelo you me public about him HIV status baby lo country too. Make him you here come. Dr. Paul Popoa Bosawai lo stage this fella morning. Thank you.
Good morning, everyone, and good morning across Solomon Islands and every listeners and good people. Blow Yumi, lo country, blow Yumi, wherever you stop and you listen, come or you tune in, lo radio. Me like for say a very good morning and happy first day, lo December, and me wish him everyone's God's blessing as he me go towards end blow year and. Me remind him everyone for stop healthy, eat healthy, sleep well, and live him a good life. For him, me continue for stop good fella lo country blow you me. Let me recognize him presence blow you me this morning, or the default representative. This morning, imi barbagai harem or harem good fella speech from default representative. Me like for on behalf of government and the people of Solomon Island for continue for thanking people and people from Australia and government blow you for supporting not only Solomon Island but also across the globe. Me also like for recognizing presence blow WHO representative Dr. Sobel that you come this morning and you deliver him now a global perspective blow HIV. This morning as well, me like for recognizing presence blow Ministry blow Health and Medical Services Permanent Secretary Ms. McNeil and Ministry of Health and Medical Service Deputy Secretary Dr. Nehemiah for Ifalakam this morning, and Superstar HIV Program Director Dr. Rakei and Okota good staff blow you and Okota Wakahad blow you for go ahead for look lo HIV issue and also what now Okota solutions for the people blow me lo country. Executive Director to blow Solomon Islands Planned Parenthood at SIPA, Mr. Jack Martin, him no come, but me also like recognize him role blow you fella for continue for advocate for Hana for control him and eliminate him HIV lo country blame, and also other good clinicians blow you me across Solomon Islands that you deal with them HIV and AIDS. Me like for say thank you lo you fella and please continue with them good worker for him is have control him and reduce him and eliminate him HIV lo country blow me, not a great stakeholder blow me where I want continue for supporting you me lo HIV and AIDS. Or them any one that you stay, you drive, you listen, but you must drive safe lo this morning lo Monday. Ladies and gentlemen, today you may join in countries and partners and communities lo world for commemorate him now World AIDS Day 2025 under within one for a theme where hemi right osem overcoming disruption, transforming the AIDS response. This for a team hemi barava kolemumi for need him now sustain political leadership, international cooperation and human rights centered approach for achieve him now SDG target for him end him now AIDS by 2030. This for the team, indeed focus on the important things where one now funding cuts and other challenges and highlight him resilience block communities blow you may and countries allow protect him now progress and move him this for the HIV response forward. The theme acknowledges the challenge and disruptions that have affected the global AIDS response. Hem also emphasizing the need for him to transform him now response for overcoming what the obstacles rather than you may try for retreat. You must not retreat. You must go forward and continue for advocate and do him everything possible for him eliminate him now HIV across the globe and of course the country blow him Solomon Islands. Hemi also showcase him resilience and dedication of communities and health workers and other stakeholders were other committed for ending now AIDS low country blow you me. This for the theme also calls for accelerating prevention, treatment and care services and ensuring no one is left behind. In 2025, a historic funding crisis is strengthening to unravel decades of progress. HIV prevention services are severely disrupted. A community-led service vital to reaching marginalized populations are being deprioritized, while the rise in punitive laws commercializing the same-sex relationships, gender identity, and illegal drug use in amplifying the crisis. Me like for taking this whole time as well for acknowledging everyone that he may work together for able for him sign him na proclamation against him drug or illicit drug law country blame me what he call them power, ice, or he sometimes call them meth for short. What a drug crisis here, hemi barava through amplify him now. All the cases hemi gare making HIV services hemi barava inaccessible. AIDS hemi no over, and given today's environment, a new transformative approach is needed to mitigate risks and helps us to reach our targets. Countries like Solomon Islands must make radical shift to HIV programming and funding. And me like for continue for thanking GNAT, Government of National Unity and Transformation, for recognizing the need for me survey increasing budget blow me where me continue for increase, and we must thank him over the senior executive theme within the Ministry of Health for him continue for work together for him is able for increase him now recurrent budget blow me this year, and also development budget for him is look and improve him now health care services blow me low country. The global HIV response cannot rely alone on domestic resources alone, especially finances that imigarem. The international community must come together to bridge the financing gap, supporting countries like Solomon Islands to close the remaining gaps in HIV prevention and treatment services, removing what some of the legal and social barriers, and empowering the communities for leading now this for the initiative way forward. Political leadership hemi barava important to us for advancing now the policies that address him structural inequalities and protect the vulnerable populations. Transformative solutions are needed to improve access to HIV services, eliminating the stigma and discrimination once and for all. Me like for encouraging and telling people blow me across Solomon Islands. That time man garem siki osem HIV imi talem, imi must not for tizi mukata, imi must not discriminate mukata. And me like for acknowledging few companies, private companies that other garem HIV policy, and one of which is GPOL. Hemi garem now HIV policy not to discriminate. And what about our putum na lo walling blokata lo every offices. And I do want to encourage all private sectors to do have HIV policy lo what our respective companies blow me across Solomon Islands, and also what the garem rights too. And so the protections of rights for women, girls, and LGBTQ plus people who continue to face disproportional barriers in accessing health care. You mean sometimes or the health work force, me understanding time lo medical school, me bara doing na intensive blo me lo training blo me lo infection department lo under internal medicine, and me look after now the HIV patients lo 1 month, and then borrow one for la experience blo me personally for look after the HIV patient. Sometimes me for la go for putum central line, and everyone fright for doing, or the healthcare workers fright for doing because of what a fear for garem now take him now HIV through procedures. But me like for talem, me one for a HIV patient, I'm teaching me garem 29 problems, and every morning time me go for check him garem new problem, and he's the one of the best teacher from infection to everything, the depression, and this for a patient me barava like for said that one of my valuable training from internal to psychiatric training, me bara take him now this for a patient where me barava one for a difficult one, and time me enter this fella infection department. Professor Blomihem say, welcome, welcome. For you who win or you Barava strong, you have a look after now this fella patient. And I could remember well how difficult it is to look after, from bed sore to psychosis to infection to all the diseases you name him associated with them. This fella had HIV patient that me look after Tamilo medical student, Tamilo medical school, and him Barava me like encourage him with the health workforce around there. Please no discriminate. You might say him or Sam, but please don't discriminate. They also have the right to access our healthcare services, low country, blow you me. And even other relatives too, me like for tell them that please, look him what a man positive with them HIV or some other no good people. Ota garem rights, and he must continue for respect him and help him and also what access him other facilities law communities blame no good now one for HIV patient stop law community come law church, but you will also discriminate. Me like ask him too, or the church leaders blame me across the country for recognizing the rights of the HIV and AIDS patients blame me. They are part of us. If they are Solomon Islanders, they also have the life that they may recognize him or some Solomon Islanders. So please, me like for encouraging me everyone for look after them over the HIV patients or AIDS patients below you me. Reduction in the HIV funding landscape, hemi barawa through now, and also even international engagement, me hear him what they call them donor fatigue. So you me low country blow me, you must start for think smart. The reduction in the HIV funding landscape calls for the consented collaboration and commitment of HIV researchers. Policy makers like myself, I am speaking to myself, and I am sure that whatever policies that we may carry, I will ensure to take it to the space that I could be influential to it. Healthcare professional, funders, media, and communities to rethink, rebuild, and rise. The HIV response has always been defined by resilience, overcoming challenges through innovation, collaboration, and activism. And me like for thank him to my health workforce, including other NGOs, for continue for doing this for a good activism, for talk about him HIV, spread him good information about how for protect him level from taking this for HIV. The HIV response must rethink its approach as shifting geopolitics and funding crisis threaten progress. Sustainable funding requires countries to rethink financing through domestic investment, innovative models, and private sector engagement or semi-talem. Other private companies or private sector must come up for helping me for start for talk about him HIV prevention and elimination by 2030. We must rebuild momentum, protecting service infrastructure and advancing science, defending scientific freedom, evidence-based policy, and civil society space is critical to help the HIV response rise above misinformation and censorship. As an evidence-based, resilience, fully funded HIV response requires us to rethink, rebuild, and rise with effective policy making, a commitment to innovation and strong collaboration. Previously, before 2024, we have been detecting on average, detect him or find him 1 to 2 cases low 1 year. Last year, look him surge or increase low HIV cases, and record him now 8 new cases. This year, record him 34 new cases and total up to 79 cases. Of these 34 new cases, 25 now are a man, 9 are a woman. Total number of positive clients now are 48, 3 of whom are not on treatment. So 3 fala now, no treatment. So me like for Talem, man you 3 fala, please come low health facilities blow you me so that you have receiving treatment. Time you receive him treatment, viral load blow HIV, bahem drop and you have garem now a long life. But if you no treat, me like advise him you will trifala, where you will listen come lo me, you will no cross. Please come so that you have taken treatment. You no fright, because you cause him on harm blow you, and also you cause him not danger for other people where you no taken treatment. And if you man you positive and you no taken treatment, please, me must pigeon, you know all about. Yeah, you must help him, you me, for reduce him now HIV cases across Solomon Islands. 27 have succumbed to advanced HIV disease and its complications, and 4 fala where other foreigners or other retain now low countries where other come from. Regionally, neighboring country Bloimi Fiji and PNG ose mimi listen lokata tuvala speakers ya go finish ota barava garem big increase lo HIV. Fiji hemi declare him HIV outbreak last year where him barava related now lo IV amphetamine drug use, and PNG him recorded around 11,000 cases last year where him double him now this for a figure during the past years go finish. Yumi barava lo high risk of taking HIV come lo country blow yumi because of frequent travels lo Solomon Islands go lo Fiji and PNG lo this for la tufala Melanesian brothers blow yumi lo region. Ministry of Health through the National HIV, STI and Viral Hepatitis Program and partners are committed to address the surge in HIV cases, and is working towards updating and developing HIV policies, strategies, and guidelines in our response to curb the HIV situation inside the beloved country, Bloyumi. Yumi need him now for strengthening him now prevention measures, Bloyumi, testing and screening, and also treatment strategies, and also decentralize him now. This for the service goal of the provinces Bloyumi across country Bloyumi. Our prevention of mothers to child transmission of HIV, if you follow listen come possible for mommy passing golo picking, not only for HIV, syphilis, and also hepatitis B. So our prevention of mothers to child transmissions of HIV, syphilis, and hepatitis B strategy must be resilient and sustained. Health workforce training on HIV service must be tailored across the country. Let me also acknowledge him, Director Dr. Rakei, for the trainings below you that me learn him through what the reports that you continue for doing. Please continue to do so, because sometimes time me health workers me train, me by remember well, time me go attend him training. After he finish training, he forget him more the strategy. Yeah. So continuous training is very important, and that's the sustainability of this initiative. We need to ensure that our HIV commodities and consumables are in stock and streamlined to the provinces. Also, Mitalem, sustainable medical supply, one of the 5 pillars that we continue for advocate for him, lo domestic space and also lo international space. Strong worker together, Bloimi, and commitment between other stakeholders, NGOs, CSOs, churches, communities, and leaders, Hembarava demanded for a successful HIV responses. Prime Minister Bloimi, Honorable Jeremiah Manale, upon Hemi Save lo current HIV situation, where Hemi declare him that this one Hemi Barava one for a national issue of concern. Me Barava like for acknowledge him and value him now partnership Bloyumi with him over the good, kind, and great development partners like DFAT, Bloyumi, and of course Pami must tell them na country Australia and Australia through DFAT, where you continue now for giving me for the funding and prioritizing the National HIV Program Response Plan. Me but I like for thank him, Dr. Tristan, for every time me drink coffee sweetened, but you talk about him now. How can we declare HIV here, Solomon Islands, so that he must have taken funding? So I would essentially wish to acknowledge Australian government and the people of Australia through DFAT for your funding and prioritizing the National HIV Program response plans. Also, I would like to take this opportunity to sincerely acknowledge WHO for your technical support and SIPA as an implementing partner. We must work together, both us all here, including your Minister of Health, plus those that are living with HIV. While we respect and value who you are as a Solomon Islander, please let's work together. Yeah, you live with HIV, me like for you, come forward and talk to us. Come to the health facilities and receive treatment. Not tested positive, no more than you run away now. Please, don't do that. You are not helping anyone. You are not helping yourself. You are not helping your communities, your family, and of course your country. Me like for say, let's work together to eliminate HIV by 2030. I now declare that the commemoration of the World's AIDS Day open. And I thank you very much for listening and to all that we gathered here today. I thank you.
Thank you very much. Barava good to us for imigarem one fala member you him stand up here and barava stand for the right of people in the country, responsible person for health you everyone and him good that him barava give come speech for you. Listen, come. You where you got him HIV, come forward for taking treatment. You where you got him HIV, make sure your partner him also come forward too. Yeah, no good now you say you come and your partner him continue for go out, him not take him assistance or help where him should get him. So make sure if you survey that you got him HIV, make sure that partner you or whoever you stop with him or you associate with him in a way that you survey him pass him HIV him, make sure him to him come for test. And you start doing testing you every clinics law Honiara City Council him got in place where you survey go or clinics, and if you ask me like check him health status me, especially the side the HIV, they can do that for you. Provincial him same too the provincial centers, and as well look nearest clinic you. If you go to him no got testing kit or him no save doing that one, him save refer him you the right place for you take him treatment or testing you, and then you come for treatment or the HIV program the National Ministry of Health and Medical Services now save giving this one. And again call upon everyone come forward. You know fright him same or some people were got him other sicky you miss have say this person has this disease, him got him high blood pressure, sugar. HIV is one disease as well. It's not something that you miss have say this a person him got him HIV, therefore no any service been provided for him. Him baravan oseme. Anyone him sicky, whatever sicky him kasimu, come forward. Health services blame him provided for everyone. As long you are in the Solomon Islands, the health services him free for you come use them. So make every effort time in me free medical services. Barava good opportunity out of keen listeners and people where here come or look come have opportunity where me save come not only for HIV but even other health status you like for save come forward the nearest clinic you for take him checking you, and as well use have a quick time for take him treatment. As Dr. have mentioned him or our honorable have mentioned him, you take him treatment, you have a live healthy for longer. But if you run away and you not take him treatment, that time now but you have a risk him other family members or community members and Solomon Islands, and as well you shorten him life you no more. So you have a stay healthy and for longer if you take him treatment you quick time as well. So that's a very good speech there Mifala Barawa. Thank you Thomas, Honorable Minister, for taking your time and speaking to our people. You may not take him any recording by out the good people. Him barawa calm down lo SIBC live broadcast talk savely you me public lo Solomon Islands that him minister honorable minister were responsible for health you me, and that's the call where him give him come forward for testing and take him treatment proper. I think that one him also conclude him now. This for commemoration official launching official program. We will have a break straight after this one. We'll come back at 9 a.m. to 10 o'clock by Imigare one for talk back show and everything where you just heard him or the panelist by sit down. If you got any questions, use have a text cam 76500 him number where you have a text cam question you or comment you. We will take any comments with regards to HIV or any questions with regards to HIV issues country me for this fella day. So stay tuned. We'll come back and catch up with you more at 9 a.m. this fella morning. Don't go away. Stay tuned. Turning back radio 9 a.m. and stay tuned. You top up too. Make use of a text cam lo SIBC. With him this one from the official launching program. Guest speakers, me for like for thanking you, Honorable Minister, for sit down with me for here, DFAT representative, WHO rep, and PS where you come. Me fella thank you Thomas for heart do you fella where you fella give him look country blown fella have very early in the morning that me fella come, but thank you so much. And on behalf of Solomon Islands who are listening, me fella thank you too. SIBC for giving life for me fala look inside local where me fala inside queue this time or buses, taxi and wherever me fala lehem save herem this fala information straight first hand information. So thank you very much. Me MC Blow you die Magiro Tagyo Thomas looking you lo 9 a.m.